Welcome to the monthly webinar of the Philippine College of Lifestyle Medicine. We are delighted to have you join our activities and enjoy the learning sessions offered by the PCLM Education Committee. The Philippine College of Lifestyle Medicine is the newest affiliate specialty society under the division of the Philippine Academy of Family Physicians. Tonight we will dig into the only way to treat and reverse fatty liver disease. Our speaker is no other than the current president of the Philippine College of Lifestyle Medicine. Dr. Michelle Acero Palma is a family medicine physician and a fellow of the American College of Lifestyle Medicine. She served as the education director of the Philippine College of Lifestyle Medicine and the Asian Society of Lifestyle Medicine. She is the current president of the Philippine College of Lifestyle Medicine and the president of Remnant Institute Incorporated. Together with her colleagues, she pioneered the lifestyle medicine education curriculum in the College of Public Health. She is also the founder of Culinary Medicine Asia, which was launched in 2016, and is now utilized in many different educational platforms, including public health and medical education curricula. Dr. Palma believes that integrating lifestyle medicine education into the medical and interprofessional curriculum is the key to advancing the practice of lifestyle medicine in the country. She is currently an adjunct professor at the Adventist University of the Philippines College of Medicine and College of Health. Dr. Palma is the head faculty of the Philippine Lifestyle Medicine Competency Course, a member of the review team for the Lifestyle Medicine Core Competency by the American College of Lifestyle Medicine, and the director of the Philippine Specialty Board of Lifestyle Medicine. Kindly give your undivided attention to Dr. Michelle Acero Palma as she talks about the treatment and reversal of fatty liver disease.
Good evening, everyone. I'd like to thank you again for joining us in our monthly webinar. This is brought to you by the Education Committee of the Philippine College of Lifestyle Medicine. So yes, we'll be talking about ways to treat and reverse fatty liver disease. And this is where lifestyle intervention or lifestyle medicine really plays a huge role. For tonight, this will be a short discussion with the following outline. So let's just have a brief overview about NAFLD, NAFL, and then NASH. And then we'll be talking shortly about disease initiation. So these are the predisposing factors. We'll also touch on the disease impact and looking at how, what's the impact of NAFLD in liver transplant, the incidence and prevalence of hepatocellular carcinoma. And then we'll also look at who to refer whenever a patient has elevated liver chemistry, or there's incidental fatty liver findings on imaging, or if the patient has some type 2 diabetes diagnosis, and to include here in additional are patients with metabolic syndrome. And then lastly, we'll be talking about the treatment potential. Is there any way to achieve remission, regression of the disease using lifestyle intervention, weight loss program, and let's also touch clinical trials with regards to the therapeutics available right now. So here, the non-alcoholic fatty liver disease is actually the umbrella. So in here, this is a steatosis seen on imaging or histology, of course, without significant alcohol use, or the use of steatogenic medications. So here, patients could be having non-alcoholic fatty liver, and this is more than 5% hepatic steatosis, of course, without the evidence of hepatocellular injury in the form of hepatocyte ballooning, or the patient can have non-alcoholic steatohepatitis. This is NASH, which is the more aggressive form in this type of disease. And this is over 5% hepatic steatosis with the presence of inflammation and hepatocyte injury, such as ballooning. This could either be with or without fibrosis. Now, looking at the spectrum of NAFLD, or non-alcoholic fatty liver disease, if you look at the red, the left side here, you will see that that's the normal liver. However, around 30% of the population may have hepatic steatosis or the NAFLD. And among patients with hepatic steatosis, about 25 to 30% of them may develop non-alcoholic steatohepatitis or NASH, or this is the more aggressive form of fatty liver disease. So I would like also to our patients to understand, those who are joining us and watching us who are not physicians, but patients, who have fatty liver disease. This is actually a very important information for you to know that are in around 5 to 10 years, according to studies, patients who have NASH or non-alcoholic steatohepatitis, 5 to 18% of them may actually progress to cirrhosis, or patients with cirrhosis may actually progress with hepatocellular carcinoma who will be needing liver transplantation. So nowadays, whenever a patient is diagnosed with fatty liver disease, it doesn't seem to be so important for them to get treatment, right? So you'll always hear patients being told by their physician that that's not a problem, and they'll just give some food supplements, that will help the liver, and that's it. Basically, because we do not really have proven therapeutics for fatty liver disease. And so doctors would actually end up prescribing just supplements, amino acids to patients with fatty liver disease, and that's it. But there's more, there's more we could give our patients, and so that hopefully we can help our patients achieve remission, and halt progression of their fatty liver disease. All right, so this is the burden of NAFLD, and as you can see, Philippines is no exemption. Asia actually is included in this study, and you will see that about 30% of the population worldwide actually are affected with NAFLD or non-alcoholic fatty liver disease. And this has something to do with the incidence of obesity, the growing number of obesity, and the obesogenic environment around. And metabolic syndrome and diabetes type 2 has also something to do with the development of fatty liver disease. Now, looking at the predisposition and triggers of fatty liver disease, of course, genetics will play a role, which will be producing various phenotypes in terms of NAFLD. But of course, we are more concerned about the initiators. Example is adiposity, which is one of the main factors, systemic inflammation, for example. But please take note that genetics may determine the predisposition, but they do not actually indicate that the disease will definitely develop. So there is always a trigger, and lifestyle is considered as the key components in the development of this condition, or in the pathophysiological factor in fatty liver disease. So this is weight gain due to dietary excess and sedentary lifestyle. So like I said earlier, there is an involvement of insulin resistance and metabolic syndrome. So with regards to the pathogenesis of NAFLD or non-alcoholic fatty liver disease, now we know that there are those predisposing factors, but there are disease initiators, which we already discussed earlier. More of those are lifestyle related. Obesity is one of the key, but there are perpetuating mechanisms, because not all obese patients may have fatty liver disease, right? Now we have what we call the perpetuating mechanisms, which literally involves behavior, things that we put inside our mouth. Literally, most of this are the diets or the drinks, that we take every single day. This is where sugary beverage could come in, or this is where fat-laden foods can come in. So this is specifically eating behavior, which may result to dysbiosis, and then resulting to metabolic inflammation, apoptosis of the hepatocytes, and eventually fibrosis, resulting to different disease phenotypes in non-alcoholic fatty liver disease. Now, with regards to the impact on liver transplantation, as you can see here, since 2012 to 2014, there was an exponential increase in liver transplantation secondary to non-alcoholic steatohepatitis. So that is second to hepatitis C. Okay, so now what are the current pharmacological treatment for non-alcoholic steatohepatitis? So let's say, for example, our patients were already diagnosed with NASH, or let's say patients are already diagnosed with NAFLD. What can we do? What can we give them? Now, with regards to NASH, currently there is no FDA approved therapies for NASH. However, there is currently available therapeutics with proven efficacy, although there are some issues, and this includes vitamin E and pioglitazone. And there are more limited data with regards to several medications like liraglutide. So here, this study actually, pioglitazone, was compared to vitamin E and then the placebo. Here, this is a 96-week study, and there is an indication here that vitamin E may improve outcome of patients with NASH and patients with NAFLD. And in this study, they used 500 milligrams of vitamin E BID. So they're taken twice a day. Now, there are several drugs here that are either under phase 2 or phase 3 clinical trials with regards to medication or therapeutics used for NASH, or our goal is the resolution of NASH, which is the primary outcome. So again, those medications are not yet approved as therapeutics for patients with NASH and NAFLD. However, in this meta-analysis, including over 1,700 patients, actually, sorry for the clerical error here. You will see here in this study, actually, they are saying that patients with NAFLD and fibrosis are at increased risk of all-cause mortality compared to patients without fibrosis. And nowadays, we're thankful that there are diagnostics that our patients can have so that we can see the risk factor, and hopefully we can give interventions to them. However, this is where limitations can come in, and this is where the gap would come in. So as internists, as a family medicine physicians, or as general practitioners, whenever we encounter patients with NAFLD, with or without fibrosis, then we are left with prescribing patients with supplementation for the liver, and then we just tell them, we just have to improve your lifestyle. But how specific it is that we need to provide them, how specific the lifestyle intervention would be, what should be the dosing, how intensive should the lifestyle intervention could be, and how will we be able to provide weight loss program for patients so that they can sustain this for a year, for example, so that we will achieve remission and avoid progression of the disease, is the question in the management among patients with NAFLD and NASH. And in this study, it's telling us that yes, all of these patients needs lifestyle modification, and this is the cornerstone in the management of patients with NAFLD or NASH. So whether we would like to give patients supplementations or medications for their liver, lifestyle intervention is the key component in the management treatment. And if we are aiming for reversal or remission of non-alcoholic fatty liver disease, of course, this includes calorie restriction because we wanted to achieve weight loss. And speaking about weight loss, there is a dose-response relationship in terms of how much percentage of weight loss you may have and the impact or the outcome in the patient's liver histology. So like, for example, patients who achieved about 10% or over of weight loss, there is an actual fibrosis regression that was established in there. And this is 45% of the patients. And this is according to the data of 4 randomized clinical trials. So among patients who achieved 7% weight loss, there is a note of NASH resolution, and that is about 64 to 90% of patients. For those who were able to achieve 5% weight loss, the ballooning or inflammation were observed among 41 to 100% of the patients. And even just 3% of weight loss, steatosis is observed among 35 to 100% of the patients. So these outcomes are not noted in any medical or therapeutic prescriptions or drugs that we prescribe our patients. These are only achieved through lifestyle intervention with an outcome of weight loss in such percentage. Okay, so here again, the outcome would depend on the degree of the weight loss of the patient. So what do we do in a lifestyle and weight loss program? So how do we do this in lifestyle medicine? So this is where our patients can be referred. For example, so if you're an internist, cardiologist, surgeon, for example, or your family medicine physician, general practitioner. So if you want to help your patients achieve regression and remission in non-alcoholic fatty liver disease or NASH, you can refer patients to a lifestyle medicine physician, lifestyle medicine specialist who can help them provide a sustainable lifestyle program to achieve these outcomes. So this is just an example of what we do in a weight loss program. So this is usually a 52 weekly group session for those who have BMI over 30. And we also have a shorter program for those who have BMI less than 30. But of course, it is included in all of this in whether the patient has over or below 30 BMI. Intensive therapeutic lifestyle change is included. That's what we do. Usually we do this in a group of 20 patients per program. We usually have shared medical appointments, group visit, group activities, and follow-ups, you know. And we also have ongoing program after 1 year. You may be asking, why 1 year? Why not only 12 weeks? Because that's how we're supposed to manage patients with fatty liver disease. Evidences are telling us that weight loss, you know, that is achieved in a longer period of time can be more sustainable than those who had drastic weight loss for the past 3 months. And then they will be experiencing the yo-yo effect. That means they will be regaining the weight again. So evidences are just telling us that we can sustain weight loss or intensive lifestyle program if this is about a year, you know, or so. But of course, we also support evidences telling us that in as little as 12 weeks, you know, to 20 weeks, we can also achieve remission and halt progression of non-alcoholic fatty liver disease. And this is to include diabetes type 2 and metabolic syndrome with this length of lifestyle intervention. So every lifestyle intervention varies. So there are face-to-face programs or sessions, and there are virtual programs or sessions as well. But for sure, there is an ongoing follow-up for sustainability. So this is the process. Usually, we start with information session, and then we proceed to orientation and then screening of patients. And of course, the program implementation, which may run from 12 weeks to 52 weeks. So what are the program components? Of course, we begin with behavioral change. We have many strategies that we use in lifestyle intervention. It's not just prescription that we provide patients. We do not just give lectures, you know, we converse with them. we establish good relationship with them. And this is a collaborative team. It's not only the physician, the lifestyle medicine physician working in here. We have lifestyle medicine coaches. We have our nutritionists and dietitians helping our patients go through the program. So of course, in the process, that includes goal setting, relapse prevention, problem solving, solving impulse control, eating restraint, assertiveness, so on. And so forth. Please take note that any individual will never be able to change a behavior overnight. It's a continuous process, and usually this is a difficult process, specifically with dietary preferences. Yeah, because dietary intake has cultural inclinations, familial inclinations. That's why this is where culinary medicine can come in. So we do not actually shock our patients, to change their diet 360 degrees, or we do not want a what do you call this, instantaneous paradigm shift in terms of their lifestyle, because we want this to be sustainable. It could be ideal for us as physicians or as providers to plan for them. We actually have to meet the patients from where they are. So whatever is applicable for them, whatever is feasible for them, that's where we begin. That's where we start. So other patients may be really fast in terms of changing their behaviors, but there are patients who may take baby steps, one small step at a time, and that's not really a problem, because we celebrate every we celebrate every Again, any person can actually have their own pace of behavior change. Others may be really speedy in terms of changing their dietary patterns, but other patients may take small baby steps at a time. And that's not really a problem, because we want to celebrate every small changes, that's happening in patients' lifestyle, because even small changes can actually be impactful in terms of clinical outcome among patients with NAFLD, patients with diabetes type 2, and patients with metabolic syndrome. So another component in a lifestyle program is actually nutrition. So in nutrition, if we are working, of course, for weight loss program, so there is about 500 to 1,000 calorie per day restriction. Or this is a calorie deficient food plan that we provide our patients. So our goal here is to give them about 1,200 to 1,500 calorie daily intake. There is also fat restriction to less than 30%. Usually, patients would generally consume over 35% of their calorie from fat. And we want them to consume less than 10% of their calories from saturated fat. And of course, the source here should be the healthy fat sources, whole food sources of fat. And carbohydrates here are given about 45% of the caloric intake. Protein is about 20 to 30% of the daily intake. And the goal here is actually to transition from animal-centric to plant-centric plate. So again, this is where culinary medicine can come in our nutrition, in our nutrition therapy or nutrition program. And of course, this is where we talk about how can the patient transition from unhealthy food choices to healthier food choices. It's not only giving them the prescription of eat this and eat that. Oftentimes it does not work anymore. So we often work with what the patient could actually do so that our prescription will not end up in a trash can. So again, physical activity is included in the component of this program. So we initially start with non-exercise activity thermogenesis. So these are non-exercise activities. This is not talking about walking or jogging or doing aerobic exercises or resistance training. So we initially start working on or telling our patients of moving more and sitting less and participate in household chores. Just move more, and sit less. Just do things around gardening maybe, or something else that they are passionate about. We just wanted them to improve their mobility, and when they are starting to lose some weight, then that's the time we talk about the structured aerobic exercise, because we do not want to hurt their knees, so especially among patients who are really obese, because if we want them to walk right away or jog right away, they might be hurting their joints, and we do not want that to happen, because of course we will never be able to sustain a good physical activity in the long run. And that's when we start with the structured aerobic physical activity, including resistance training of about 2 or more days in a week. All right, so again, this is a short discussion, like I was saying. In summary, we have discussed that NAFLD is estimated to affect a quarter of the world population, and young people are not actually exempted. So it's disturbing to see our young people affected with NAFLD, with this kind of disease that we know that in the next 5 to 10 years they may be able to develop cirrhosis and hepatocellular carcinoma and would be needing liver transplant. So I really hope that doctors who are joining us tonight and patients who are also joining us tonight would be actually informed that fatty liver disease is something that we do not neglect, something that we do not put attention to, because they can progress, okay? They can be aggressive, okay? And lifestyle modification and management of metabolic syndrome remain the cornerstone of management for patients with NAFLD and NASH. And of course, we also learned that pharmacotherapy is on the table, but there's many unanswered questions. That's why even until now, there's no proven FDA has no list of proven drugs that can benefit patients with NASH. And so again, in conclusion, it's lifestyle modification that is the only remedy, the only treatment, and the only way to reverse the condition of patients with NAFLD or non-alcoholic fatty liver disease, and even patients with non-alcoholic steatohepatitis. Now, if you want to learn more about lifestyle intervention, if you're a physician, you can visit our website. This is the website of the Philippine College of Lifestyle Medicine. And if you're a patient and you need physicians for lifestyle medicine programs, or if you're a physician who wanted or who needs to refer your patients to lifestyle medicine physicians, you can visit the same page, because you will have there the list of physicians who are certified lifestyle medicine practitioners. And we also have contact form right there. Our secretariat may be able to help you reach out lifestyle medicine physicians nearest your vicinity. Lastly, I am connected with the Remnant Institute Incorporated. We also offer programs for patients with non-alcoholic fatty liver disease. So we have programs for obesity, we have programs for diabetes type 2, metabolic syndrome, and etc. You can also visit our website, and you can reach out to us. And lastly, if you're interested to learn more about culinary medicine, what are the dietary programs, or what are the nutrition prescriptions, that you may give your patients with non-alcoholic fatty liver disease and other diseases like diabetes type 2 and metabolic syndrome that has contribution to NAFLD, you may want to have a copy of this book. This is Culinary Medicine. This is already out of the market. You can get this from KDP in a form of an ebook, or you can also order a paperback. But in the Philippines, we already have the hardcover production of this book. So again, this is nutrition and cooking. We combine both to improve our patients' health outcome. Thank you so much for your undivided attention.
Thank you for joining us. And we would be glad to gather feedback and questions through our chat box. Our team will gather your messages and send them to our speaker. Kindly anticipate answers through the chat box. Our team will also post the feedback form in our chat box for your perusal. Again, thank you for joining the monthly webinar of the Philippine College of Lifestyle Medicine, and we hope to have you again next time.